Good afternoon. Welcome to the Innovation Hub and to today's session, Practice Makes Perfect, How APEX Accreditation Puts Quality and Safety at the Heart of Patient-Centered Care. My name is Jean Wright, and I'm a radiation oncologist and Vice Chair for Safety and Quality at Johns Hopkins Department of Radiation Oncology. I'll be joined today by Dr. Christin Knowlton, who is an Associate Professor and Medical Director of the Smilow Cancer Center at Yale University, and by Dr. Colleen Lawton, who is Professor and Vice Chair at the Medical College of Wisconsin. None of our speakers today have disclosures. I'd like to start by welcoming everyone to today's session. We're very appreciative of your interest in the APEX program. We hope that we'll be able to provide an overview of the APEX program, including the philosophy and structure of the program, as well as the details of the process of applying for accreditation through APEX. Each of us will also share some of our own experiences with our own facilities and departments with the process of APEX accreditation. And at the end, we'll close with some information on ongoing accreditation and reaccreditation through the program. So what is APEX? APEX is ASTRO's Radiation Oncology Accreditation Program. So this is an accreditation program that is completely derived from members of the radiation oncology community through ASTRO. The program provides a framework for quality improvement and quality maintenance that aligns with regulatory requirements. And so hopefully we'll see as an ongoing theme throughout the presentation that quality improvement is one of the cornerstones of the APEX philosophy. So the Practice Accreditation Program builds upon and integrates ASTRO's quality improvement initiatives into clinical practice. The program establishes standards of performance that are derived from ASTRO quality assurance and safety white papers, consensus statements, and AAPM task group reports and technical standards to form the framework for the essential components of APEX. The standards reflect the competencies and the practices that are identified and endorsed in the publication Safety is No Accident, a framework for quality radiation oncology and care. So APEX is really an accreditation program that is completely born out of the principles of Safety is No Accident. Now, APEX is organized around 5 thematic pillars, and I think it's important to keep those pillars in mind when we think about the individual components of the program. These pillars are the process of care, the team, safety, quality management, and patient-centered care. Now, each of the pillars is broken into individual standards, and there are 16 APEX standards. Those standards are further broken down into evaluation criteria, so the criteria upon which each individual standard are evaluated. The evaluation criteria can be supported by what are called evidence indicators. So evidence indicators are tools by which a practice can demonstrate compliance with the individual components of the standard. The evidence indicators are broken down into categories of level 1 and level 2. A level 1 indicator is one that is considered essential to high quality radiation therapy, whereas level 2 are standards that reflect opportunities for practice improvement in the areas of patient-centered care and quality of treatment, but are not considered essential to the accreditation process and to the demonstration of a high-quality care department. So while the standards align to ASTRO and AAPM standards, they're not intended to be prescriptive in terms of process for individual facilities. So it's the expectation that the standards provide the framework for the structure for the assessment, but facilities can have their own innovation and approaches to how to demonstrate compliance with an individual standard. So what we see here is a screenshot from the practice standard manual demonstrating one practice standard and some of the sub-indicators that fall under it. Now, the evidence indicators that are used to demonstrate to compliance with the individual standards can be derived from a lot of different places. These include chart review, policy and procedure manual, direct assessment of practice data such as machine commissioning and QA data, as well as an interview that's conducted with the radiation oncology team during the site visit. The program standards and the associated evidence indicators make APEX a very unique program in that it provides a very rigorous and yet completely transparent roadmap to accreditation. So the program is built on the foundation of continuous quality improvement, utilizing the Plan, Do, Study, Act model. And this slide just highlights some of the elements that are evaluated within the APEX standard. So the process for accreditation starts with a simple online application. And this is simply an application that is filled out, which includes some basic information about the practice, how many machines, how many patients are treated in a given year, how many physicians are there, what are the modalities that are utilized, whether it's 3D conformal, stereotactic procedures, brachytherapy, protons. So a facility is accredited for the different modalities that it delivers. Once the application is completed, and again, this is simply an informational input, the facility moves on to the self-assessment. So at this point, the APEX portal becomes available to the facility, and the first step is to complete a medical record review. So the facility conducts a self-assessment of their own medical records, utilizing the portal to identify compliance with each of the individual standards. The medical record review consists of not only clinical documentation like consultation notes, but also therapy and physics specific documentation such as QA, individual patient QA for that patient, timeout procedures on the treatment machine, and all kinds of supportive information as well in a patient-specific manner. In addition to the chart review, during the self-assessment, practices are asked to upload documentation that demonstrates compliance with individual standards utilizing policies and procedures and other written forms of documentation. And finally, the self-assessment guides the practice through a preparation for the interview that will happen during the facility visit. The self-assessment is the lengthiest portion of the process. Facilities can conduct this at their own pace, so there's no timeline or deadline. Practices that do not pass the self-assessment on the first go-round have the opportunity to repeat it after a period of quality improvement. In order to complete and pass the self-assessment, a minimum number of level 1 indicators are required to pass. After the self-assessment is completed, then the facility can schedule its visit. The site visit is conducted by 1 or 2 surveyors, which are typically radiation oncologists or medical physicists. The site visit consists of a medical record review, a team interview, and a on-site review of patient-specific and practice-specific documentation, including commissioning data, QA data, policies and procedures, and the like. Of note, there are facility visits that are being conducted remotely during the pandemic as well. Finally, once the facility visit is completed and the surveyor has had the opportunity to collect objectively all of the data according to the clearly delineated standards, a determination is made by the Practice Accreditation Committee. Now, the Practice Accreditation Committee consists of a range of different types of members of the radiation oncology team, including dosimetry, therapy, medical physics, and radiation oncologists. The members of the Accreditation Committee are also surveyors. So the really principal role of the committee is, number 1, to objectively review the reports from APEX applications, to recommend accreditation decisions, and when necessary, to review applicant appeals. And there is a very clearly delineated process for appeal that is available if necessary. All members of the multidisciplinary group must also participate as APEX surveyors. It's important to note, though, that the other function of the Practice Accreditation Committee is to exercise professional judgment in making recommendations towards efficiently and effectively improving the standards themselves, as well as the measurement components. So surveyors and the Practice Accreditation Committee also participate in ongoing quality improvement for the program itself, again, in a very transparent manner. So the surveyors represent a spectrum of disciplines as well as facility types. So surveyors come from both academic and private or community practices. and surveyors represent rural and urban practices as well, so that we have a spectrum of experience within the surveyor and practice accreditation team. As you can see here, the majority of practices that have participated in the program are private or community practices, although about a quarter of the practices are academic or university. Most of the applicants thus far have also been single facilities, although there is an opportunity for programs to participate as a group where you have a main facility as well as one or more regional or satellite facilities. And you can see that at least half of facilities have at least one satellite location that is accredited together with the primary center in a single APEX application process. So at this time, there are 291 facilities that are enrolled in the APEX program, and the number of surveys that have been conducted is 198. On average, ASTRO performs 38 new facility visits per year and reaccredits an average of 32 facilities per year. ASTRO at this time has a 100% retention rate for facilities who complete the initial accreditation, moving on to completing a reaccreditation when the time comes. You can see here that about 80% of practices receive accreditation at the time of the initial application. There is also a possibility for a provisional accreditation or a denial when necessary. The reason that we believe that so many facilities do obtain full accreditation on the first go-around is due to the self-assessment process and the opportunity for process improvement throughout the APEX accreditation. During the self-assessment, there is an opportunity to put measures in place, quality improvement practices in place in order to improve from the self-assessment phase to the facility visit. And so the process itself supports quality improvement. What we see here on the screen is also a screen grab from the portal, which demonstrates a lot of the different supportive materials that are available to practices, including the self-assessment guide, which takes you step by step through the different standards, the evidence indicators, and the process of the accreditation. And in addition, a wealth of resources, including sample policy and procedure documents to provide a framework for departments, as well as resources for implementation. I'm now going to turn this over to Dr. Knowlton, who will describe the Smilow Cancer Center experience with APEX accreditation.
Thank you, Dr. Wright. Hi, I'm Dr. Christin Knowlton, radiation oncologist and the medical director at the Yale New Haven Smilow Cancer Hospital Hamden Care Center. I was also the physician lead during our accreditation process through APEX and the site visit. Radiation oncology practices are very busy places with many moving parts. Like Johns Hopkins, Smilow Cancer Hospital at Yale has multiple satellite facilities. It's imperative that all members of the practice are unified by practice procedures and understand their role and responsibilities in order to provide high quality and safe patient care. This session seeks to highlight the opportunity for a radiation oncology practice to go through an objective internal and external review to discover potential gaps within their practice and utilize ASTRO's accreditation program as a quality improvement tool. Many practices are not required to seek accreditation and therefore do not understand the benefits of the accreditation process. When we first decided to pursue national accreditation for our department, we created an internal committee with representation from all aspects of our department, including the physicians, medical physicists, quality and safety officer, radiation therapy representation, dosimetry, nursing, and administrative and clerical staff. Once we determined who would be the key players in our accreditation process, we then discussed why. Why were we pursuing national accreditation? Our goals were to ensure the highest standards in regards to patient care and safety, and we wanted to use the accrediting body standards as a benchmark for best practice. As Dr. Wright discussed, another goal was to set standards across all of our facilities within the Yale New Haven health system. Once our motivations were clear, the next step was to determine which accreditation program to participate in. We were drawn to APEX for several reasons. First off, we were happy that it was under the auspices of ASTRO, which is the premier radiation oncology society in North America. We liked the fact that ASTRO concentrates on radiation oncology. In addition, the published APEX standards and evidence indicators on the website were quite impressive. They were very thorough and very detailed. And what really sealed the deal for us was the self-assessment. The self-assessment is performed by the facility and it allows for excellent preparation before the site visit. The facility is given more than one opportunity to pass this very thorough self-assessment, and APEX provides formalized feedback during the process. The self-assessment and the feedback are included within the initial cost of the accreditation program. And we were correct in our thinking that the thorough preparation afforded to us by the self-assessment would lead to a successful site visit. As for the when, well, we decided there was no time like the present, so we got going. And as regarding the how, the ASTRO and APEX staff, as well as the materials available on the ASTRO website and in the APEX portal, were very helpful in guiding us through the process in a step-by-step fashion. As Dr. Wright mentioned, the first part of the APEX accreditation process is the initial application. This is available to the radiation oncology practice through the APEX portal, which is a secure, program-specific online platform. The application requires submission of information about the facility, such as facility name and location, the name and location of any satellites to be included in the process, the number of patients treated per year, key personnel, available equipment, what treatment modalities are offered, what disease sites are treated, and which physicians treat at which facilities. This is the facility's first foray into the APEX portal, which is full of really helpful resources. The requirements for the APEX program and all the steps are clearly explained in the resources available in the portal. The APEX self-assessment guide is in there and it provides detailed instructions as well. This is available to facilities once they have started the application process. That being said, there are numerous materials regarding APEX available on the ASTRO website for all to look at that provide quite a bit of detail. After the application is completed, the next step is the self-assessment. The self-assessment is a key feature that separates ASTRO's practice accreditation program from others. APEX's self-assessment is a thorough preview of what will be assessed during the facility visit, and it provides an opportunity for a practice to undergo self-reflection and investigation. Thus, any deficiencies or areas of non-compliance can be addressed through continued quality improvement prior to the site visit. The self-assessment must be completed prior to the scheduling of the site visit. And whereas other programs have higher rates of provisional accreditation, ASTRO's process has led to the Practice Accreditation Committee awarding full accreditation approximately 75% of the time due to the strength of the self-assessment. As you can see, there are three components of the self-assessment. First is the medical record review. The medical record review requires internal review of 15 to 25 medical records for compliance with the APEX standards. The available APEX resources provide guidance to help the facility to choose medical records that will represent all treatment modalities and all physicians at the main site. There is no protected health information to be entered into the APEX portal. The evidence indicators assessed in the medical record self-assessment focus on all areas of the department, such as physician documentation, physics QA testing, the performance and documentation of timeouts and other safety events by radiation therapy, and performance of patient education by nursing prior to the start of treatment. During this process, we discovered some areas for improvement, such as ensuring that physician treatment summaries were being routed to the referring provider. In addition, while all physics QA was being performed properly, we determined ways to improve our documentation of these procedures. After the medical record review is completed, the radiation oncology practice then moves on to the next step of the self-assessment, the document upload. Uploaded documents include policies and procedures and other materials evidencing quality and safety procedures. There are about 55 required uploads. This was a very important and ultimately highly rewarding part of the application process for us. We realized that our policies and standard operating procedures were not necessarily complete and needed some updating. This was the most time-intensive part of the application process for us, but it was well worth it. Now we have well-organized and updated standard operating procedures and policies to cover all aspects of patient care and quality and safety measures. The APEX portal provides resources, including the self-assessment guide, but also sample documents that we found invaluable in our work to update our policy and procedure documentation. For both the medical record review and the document upload, an interim feedback report identifies the extent to which the practice is compliant with evaluation criteria and highlights deficiencies that should be addressed as part of quality improvement. During our self-assessment, there were some areas in the document upload that required further attention. The feedback and the resources from APEX were extremely helpful. Once addressed, we resubmitted our materials and passed this section of the self-assessment. The third portion of the self-assessment is the interview preparation. In the APEX portal, interview preparation questions are provided to the facility, and they provide a framework to ensure that all areas of the department will be prepared for the team interview. As part of the self-assessment, the radiation oncology practice is required to read through and answer the interview preparation questions, which, for the purposes of the self-assessment, are organized in a yes-no fashion. At Yale, we met and we went through the interview questions together. And even at this point, we found some areas in which we could strive to improve. The questions provided an excellent basis for our interview preparation. As mentioned previously, the feedback provided through the APEX process was invaluable in helping us to be ready for the site visit and, most importantly, to ensure that our policies and procedures, documentation, and day-to-day operations met the APEX standards of high-quality, safe, patient-centered care. ASTRO believes that performance review and objective, timely feedback are important value-added aspects of our accreditation program. This slide shows an example of the feedback reports that a practice receives. APEX participants have indicated that they value this interim feedback report as an important tool to prioritize quality improvement activities at their facility. A facility visit is scheduled within 2 to 4 months after completion of the self-assessment based on the facility's availability. It is completed in 1 working day, including the visit to the main site as well as the satellites. Information to prepare for the facility visit is provided upon upon confirmation of the survey date. A teleconference is conducted between ASTRO staff and the facility about 2 weeks before the site visit to go over logistics and answer any questions. After our thorough self-assessment and this teleconference, I must say that we did feel quite well prepared for the site visit day. As Dr. Wright mentioned, surveyor teams include a medical physicist and a radiation oncologist. At our main site, a radiation therapist from ASTRO also participated in the site visit. At our satellites, there was one surveyor per site, a medical physicist. The satellite site visits were each a half day, so the medical physicist went to one satellite in the morning and a second satellite in the afternoon to complete 2 half days. So there was a medical physicist we had 4 satellite sites, so we had 2 additional medical physicists to do the satellites on top of the main team at the main site, which, as mentioned, was the medical physicist, the radiation oncologist, and the radiation therapist on the APEX team. Each surveyor objectively assesses the facility by entering data and pertinent notes into the APEX portal. The surveyors do not provide guidance or results during the site visit. They act as data collectors. At our main site, the site visit began with introductions and a tour of our department, and then the medical record review began. It was conducted by the radiation oncologist and the medical physicist on the APEX surveyor team. Members of our staff were present to assist with navigation through our electronic medical record systems. During the medical record review, as the surveyor reviews each chart, the information is recorded into the APEX portal by the surveyor. Components reviewed include completed and signed directives and prescriptions, consent forms, pathology reports, medical history and physical exam, on-treatment patient management and follow-up, simulation, treatment planning, and quality assurance activities. A minimum of 10 medical records will be reviewed, and each component is assessed according to clearly delineated APEX requirements. At the same time as the medical record review is going on, the medical physicist from the survey team verified our equipment, reviewed QA documentation, and performed a physics interview with appropriate staff. The physics components of APEX are extensive and follow guidelines itemized by AAPM task group reports and technical standards. ASTRO often receives positive feedback from the physicists at APEX accredited sites, stating that they appreciate the attention to standards and compliance that APEX offers. They feel it helps determine weak spots that are then able to be addressed, thus strengthening the overall quality of patient care and treatment delivery. The second part of the on-site survey visit is the team interview. The surveyors meet with representatives from each professional discipline for an interview. The purpose of this interview is to hear from all staff about their understanding of and their roles in the processes and procedures undertaken as part of the review process. The radiation oncology practices, policies, and procedures should be available for reference if needed. Here are some frequently asked questions that the APEX staff have received from facilities prior to starting the accreditation program. Question 1 states, am I able to get the self-assessment guide before applying for APEX? Well, the short answer is no. The self-assessment guide is proprietary information and is only shared with the radiation oncology practice once ASTRO has processed payment for the APEX program. You will then have access to both the self-assessment and the guide and the self-assessment itself as soon as your payment is received. That being said, as mentioned on the APEX website, through ASTRO, the ASTRO Apex website. There are multiple resources available that provide a wealth of information on the Apex Accreditation Program. Question 2 here addresses the required self-assessment prior to each site visit. For us, the thorough self-assessment was a key reason why we chose to pursue accreditation with Apex. A unique aspect of the Apex program is that the radiation oncology practices must complete the self-assessment prior to scheduling a facility visit. The self-assessment is a self-study of the radiation oncology practice's compliance with the Apex standards and is considered an essential component of the program. This process promotes quality improvement and leads to higher performance during the facility visit, as it allows the facility to set a baseline and implement changes or confirm their compliance with Apex standards before the site visit. And here we see question 3, why Apex? As mentioned previously, this was a question that our internal accreditation committee at Yale pondered before embarking on this process. For our group, we like the fact that Apex is under the umbrella of ASTRO. In addition, we found the published evidence indicators to be extremely thorough and far-reaching. We really liked how they touched upon all aspects of the department. And the use of the self-assessment prior to the site visit is what really sealed the deal for us. The self-assessment and the formal feedback prior to the site visit are included in the application cost. The self-assessment truly helped us to further improve the quality of our patient care and documentation and to ensure that we were ready for the site visit. We are very pleased with the positive impact that pursuing Apex accreditation has had on our department. Next, I will pass the microphone to Dr. Colleen Lawton, Professor and Vice Chair in the Department of Radiation Oncology at the Medical College of Wisconsin, who will talk about her group's experience with the reaccreditation process. Thank you.
So I'm Colleen Lawton. I'm going to tell you a little bit about the experience at the Froedtert and the Medical College of Wisconsin. We became accredited in 2019, and we're actually getting ready for our next cycle of accreditation, which is for reaccreditation, which is exciting. And our initial experience going through Apex was actually somewhat painful. In the end, it was absolutely the right thing to do. We are excited about what we have, but we feel that it was really worth it. But we actually thought it would be easy because we have had ACR accreditation for a very long time. I think as long as ACR has had accreditation for radiation oncology. So we thought it would be pretty simple to move on to Apex, and we're excited to do something that related to accreditation within ASTRO, our own society. And it turned out it wasn't that easy. If you said to me before we did accreditation, how do you do chart rounds, or how do we documentation of machine maintenance? How do we do each of these things? I'd say, well, we all know how to do it. But what actually going through the Apex process allowed us to do is really document exactly how we do things. And in some cases, it allowed us to think further about how we were doing things and actually improve on those processes. And so that certainly was a very good thing. And it literally has you go through step by step of just how you do, as I said, chart rounds or safety issues regarding patients going through clinic, patients on the table, machine updates, equipment updates. All these processes get documented so that as new people come to the department, whether it's a therapist or a nurse or a physicist or a physician, we have a place now to go where there's a repository for all of this documentation, which turns out to be a really helpful thing. And it's been an amazing resource for our new staff. What's exciting about thinking about reaccreditation is that we actually now do have the foundation that we thought we had before, but actually didn't quite have. So going through and actually doing the accreditation process, I think that one of the reasons that it worked very well for us is that we had every facet of the treatment team involved. So obviously from the, from the front desk, the patient's first initial contact with the department, through our nurses, our therapists, our dosimetrists, physicists, and radiation oncologists, everybody had a piece of and owned a piece of this accreditation. The team that we had working on it wasn't huge. I would say 4 or 5 people, but we brought in and expressed and asked for input from everyone within the department. And I think that also got buy-in for us as we went forward in this process. As we think of accreditation and the benefits of accreditation, I definitely think that prestige for the practice is important. I know myself, if I were thinking about where would I want my treatment to be given as a patient, certainly a place that gets accredited and goes through the effort of getting accredited would be something that I would really want. I will tell you that accreditation in general has not been something that's been ubiquitous in Wisconsin, and ACR accreditation when we had that, and certainly APEX that we have now, is something that not a lot of practices did, and we always took pride that we did, and we are at the forefront again with APEX and accreditation. So I do think that it's a bit of a market differentiator. Again, from a patient perspective, that practice that goes through the effort of having somebody come in and say, you do this at the best level possible, I think is really, it's a comfort level for the patients for sure. And quite frankly, it's a comfort level for the physicians and everyone else who works here. Why is it a comfort level? Because it improves safety processes. There's just no question that APEX, going through the APEX process, helps you to think about what processes do you have in hand that are working very well, and what processes could you improve on? And again, having everyone's input allows everyone to have a voice from different aspects of the patient experience to improve safety processes. And there's no question that all of the above 3, including those improvement in safety processes, unquestionably improves quality management.
I'll now talk a little bit about the Johns Hopkins experience with APEX accreditation. So this is a bit of a simplification of our overall program, but I would say that in 2016 and into 2017, when we were initially preparing for the accreditation, we functioned more as 6 separate active campuses that were moderately integrated with one another. We have 3 campuses that are based in or near Baltimore, one in more central Maryland, and 2 practices in the National Capital Region near Washington, D.C. In particular, the 2 practices in the National Capital Region were pre-existing practices that had their own practices and culture, resources, staffing models before they became a part of the Johns Hopkins community. And so there was a different sort of approach to things at each of the different campuses. And when we looked to the accreditation process, we viewed this as an opportunity to bring all of our regional sites together in alignment as one fully integrated academic practice. That was our initial goal with the accreditation, such that we became a more unified group. By now in 2017, there are 7 active campuses, including our Proton Center in Washington, D.C. And we really used APEX as a way to accomplish this integration. So APEX helped us to identify high priority standards for all of the campuses, identify what are the important things that we need to say are uniformly expected at all of the campuses, no matter where a patient may be receiving care. And this led to the generation of a system-wide policy manual that, again, would be in place for any of the campuses across the system. It also provided an opportunity for us to optimize our electronic medical record and our planning systems for compliant documentation and standardization, including smart phrases within Epic, standardization of checklists and other data collection templates within Mosaic, as well as templates for the treatment planning directives within Pinnacle. So it was an opportunity for us to really figure out how to optimize the use of the electronic medical record for standardization. Now that we are in the process of looking to reaccreditation, it's a very rewarding moment where we see that the majority of the policies, procedures, and processes that we worked so hard to put in place for the initial accreditation are working. And the initial self-assessment shows that we have very good compliance across all of our sites with previously established practices, most of which emerged from the initial accreditation. So we view the reaccreditation more as an opportunity to update, remind, refresh our memory, and to improve upon some of the practices that we put in place for the initial accreditation. The reaccreditation also allows for a greater focus on the level 2 indicators. In order to get the initial accreditation, it's essential to focus on the level 1 indicators and make sure that all of our campuses were standardized in the level 1s. Now that those are in place, the reaccreditation is really more of an opportunity to look at our continuing quality improvement, patient-centered care with respect to focusing on the level 2 indicators. The other thing that's nice to see in our reaccreditation process is that while we have developed standards that apply across all of our campuses, each of the individual campuses still does allow for some individualized approaches. The way that things work at each of our sites is a little bit variable depending on lots of factors. Are there residents present? Staffing models, resources, different equipment, different, just slightly different processes. And we have been able to maintain some individualization of what works well in terms of how to accomplish something at our individual campuses while while holding the entire system to the level 1 standards. So it's been very rewarding to go through the reaccreditation process and just see the sort of the fruits of the initial process. The last thing I want to highlight is the opportunity for the practice quality improvement exercise that we are all required to do as part of maintenance of certification through the ABR. So through ABR, we are periodically required to complete a practice quality improvement project and to document that in the ABR portal for our maintenance of certification. So Apex has partnered with ABR to allow participation in the Apex Accreditation Program to qualify as one of the practice quality improvement projects that physicians can use. So there is, within the Apex portal, there is a very clear roadmap for the structure and the necessary meetings and documentation that are necessary to demonstrate physician compliance in this practice quality improvement project. So this is a group project that the entire department or interested members of the department can participate in. And really, it's not doing anything beyond what you would ordinarily be doing to support the accreditation application and process. And it, again, fulfills that requirement for a practice quality improvement project. So that's another very nice ancillary benefit of participating in the APEX program. With respect to reaccreditation, we do recommend that you initiate the reaccreditation process about 1 year prior to the expiration of your prior accreditation. Most accreditations at this point are 4 years, although there is also an opportunity to opt for a 3-year cycle. But in order to allow plenty of time for the repeat of the self-assessment and any quality improvement that may be necessary, we do recommend a year. The reaccreditation process really mirrors the initial accreditation. It has the same criteria and the same process. But again, I think most facilities will find that, that it's a much more straightforward thing the second time around. So again, I'd like to thank everyone for your interest in the program and for listening to our presentation. There is much more information available on the ASTRO website at astro.org/apex. You can also email ASTRO staff. And some of us who are involved in this presentation are also available today at the Innovation Hub to answer any questions that you may have. So thanks again for your participation, and we look forward to you joining the APEX community.